So you're on the front lines, a future doctor or an intern, and a sick child comes in. It can be a lot, right? But what if you had a clear, systematic, life-saving guide right in your back pocket? Well, that's exactly what we're talking about today, IMCI. Think of this as your practical guide to feeling confident and being effective when it matters most. Let's get into it.
Okay, picture it. You're in the clinic. A worried mom brings in her 15-month-old. He's got a cough, he's got a fever, he's fussy, she's scared, and you're the one they're looking to for answers. Your mind starts racing. Is it just a cold? Could it be something worse? What is the very first thing you absolutely have to check? Here's the thing. You don't have to guess. You follow a system, a powerful, evidence-based system that was designed for this exact moment. And that system is IMNCI. It's designed to cut right through the noise and give you a clear path to making the right call every single time.
So what is this thing exactly? IMCNC stands for Integrated Management of Neonatal and Childhood Illness. It's a strategy cooked up by the WHO and UNICEF. Now, what's really important for us here in India is that we adapted it to specifically include newborns. We're talking right from birth up to 59 days. The goal? Well, it's simple, but it's profound. To fight the biggest killers of kids under 5 with one unified game plan. Now listen up. Before you even think about the cough, before you reach for the thermometer, IMCNCI tells you to do one thing first, and this is non-negotiable. You have to check for general danger signs. These are the giant flashing red lights that shout life-threatening problem, and spotting them is your absolute #1 priority. So what are these signs for a kid between 2 months and 5 years old? There are 4 of them, and you need to burn these into your brain. Is the child unable to drink or breastfeed? Is the child vomiting everything? Has the child had convulsions with this illness? And finally, is the child lethargic or just plain unconscious? And this is the part you cannot forget. You don't need a whole list of these things. If you spot just one, I repeat, just one of these general danger signs, the decision is made. That child needs to be urgently referred to a hospital, period. You'll give some pre-referral treatment, sure, but your main job is to get them to a higher level of care, fast. Now, you might be thinking, is the approach the same for a tiny newborn and a toddler? Nope. IMNCI is smart about this. It splits kids into 2 groups because, well, their risks are totally different. For the little guys, the young infants, we're really worried about things like serious bacterial infections. For the older kids, the focus shifts to those common culprits like pneumonia and diarrhea. It's like having a different playbook for each age group, because you need one. Okay, so let's get back to our 15-month-old. Let's say he has no danger signs. Phew! So what's next? You follow a really clear 4-step process. After you've cleared the danger signs, you ask about the main symptoms, the cough, the fever, that stuff. Then you check their nutrition and look for anemia. And finally, you check their immunization status. It's a whole-body integrated checkup every time. And this gets us to the absolute core philosophy of IMCI. It's what we call a syndromic approach. What that really means is you're not sitting around waiting for lab results to come back. You are trained to spot patterns, a syndrome, based on a specific group of signs you can see and measure right there. This is what lets you classify the illness and act immediately. It's the secret sauce that makes it so fast and effective. And here is where it all comes together. It's this brilliant, simple, and powerful color code. If a case is classified as pink, it means severe disease. Your action? Urgent referral. If it's yellow, that's a moderate illness. You can treat that as an outpatient. And if it's green, it's a minor illness. All you need to do is give simple advice for care at home. Pink, yellow, green. That's it. That's the heart of IMNCI decision-making. Okay, theory is great, but let's make this real. Let's go back to our little guy, the 15-month-old with the cough and fever. We've already confirmed he has no general danger signs. So we're moving on to his main symptom, the cough. What do we need to check to classify it? The key sign for a cough is the breathing rate. You literally count the number of breaths in 1 full minute. Now, for a child his age, between 12 and 59 months, the magic number is 40. A rate of 40 or more is officially fast breathing. And our little patient? His rate is 48 per minute. As you can see, that's well above the line. So, what do we do with that number? We plug it right into the IMNCI chart. Let's walk through it. If he had a danger sign or chest indrawing, that's an automatic pink for severe pneumonia. He doesn't. But he does have fast breathing. And look where that lands him, right in the middle category. If he had neither, he'd be in the clear, down in green with a simple cough or cold. And boom, there you have it. Based on that one sign, fast breathing, we have our classification. This child has pneumonia. It's a yellow case. See? No guesswork. Just a clear, confident classification based on a system. So what does a yellow classification actually mean we do? Well, the protocol gives you a precise action plan. First, you give the first dose of an oral antibiotic, like amoxicillin, right there in the clinic. Second, you counsel the mother on home care. Third, you make sure she knows when to come back immediately. And fourth, you schedule a follow-up visit in 2 days. It's a complete package of care. All right, pop quiz time. The IMNCI system has a few critical numbers that you just have to know by heart. These are super high yield for your exams and absolutely vital in the clinic. So let's do a quick fire round of the numbers you have to nail down. First up, 60 breaths per minute. What's that? For a tiny infant under 2 months old, anything at or above this rate is considered fast breathing. Notice it's a higher threshold than for older kids, and it's a massive red flag for a serious infection. Next number? Less than 11.5 centimeters. This is the cutoff for the mid-upper arm circumference, or MUAC. If that measuring tape shows a number this low, it means severe acute malnutrition. This is always a pink sign, and it means urgent referral is needed. And finally, 14 days. This is how long you'll tell parents to give zinc supplements to a child with diarrhea. You might wonder, why so long? Well, the research shows that this full 2-week course not only helps with the current episode, but actually prevents future ones too. It's a key part of the plan. So let's just boil it all down one more time. The color code tells you exactly what to do. If it's pink, your main action is referral. If it's yellow, your action is treatment. And if it's green, your primary job is counseling. Simple, logical, and effective. But you know, it's really important to get that IMCII isn't just a stack of charts for you to use. It's a huge 3-part strategy. The first part is improving your skills. But it also works to strengthen the entire health system, making sure the right drugs are there, that referrals actually work. And the third piece, which is just as vital, is improving health practices in the home and community through education. And that brings me to what might be the most powerful tool you have. And it's not a prescription pad or a fancy test. It's counseling the caregiver. Think about it. An antibiotic is useless if it isn't given right. Your ability to communicate, to teach, to empower, that is often what makes all the difference. And what does that good counseling actually sound like? Well, it's a whole conversation. You've got to talk about why they need to keep feeding the child, why extra fluids are so important. You have to be crystal clear about the danger signs so they know when to come back immediately. And, of course, you talk prevention, like hand washing, and why that follow-up visit is so crucial. This is how you make the family a true partner in their child's health. So there you have it. A systematic, integrated approach that takes the chaos and guesswork out of managing sick kids. It gives you the power to make fast, evidence-based decisions that can change everything. This framework, it's simple, it's powerful, and it is absolutely proven to save lives. The only real question left is, are you ready to master it and put it to work?